I'm Dr. George Grunert. I'm a reproductive endocrinologist working with Aspire HFI in Houston. Attended Baylor College of Medicine here. I did my residency and fellowship at the University of California, San Francisco, and then came back here. We founded the first IVF program in Houston just at 40 years ago now. Princess Resectoscope I started using when I got here, coming from another program for about 5 years now. So most commonly we use them for fibroids, sometimes for big polyps you can't remove any other way, and occasionally for a septum or intrauterine adhesions. And the advantage of the Princess Resectoscope is that it's a 7mm scope. You don't really have to dilate people more than you did for a diagnostic hysteroscopy. So it's very easy and convenient to use. Some of the other systems require a much larger cervical dilation. I really like to restore normal anatomy in the endometrial cavity. When I talk to patients, I talk to them about fibroids as being the equivalent of having a rock in your shoe. And so location is everything. We want to have a nice, good endometrial cavity for an embryo to be able to implant. We really want to get a complete resection because you can't really tell where the embryo is going to try to implant. If you leave part of a fibroid behind, then you've got a problem with that area not accepting implantation of an embryo. What were my initial thoughts when we used the HF2260 generator? Basically, it works well. It's very easy to set up. It's easy for the nurses to set up because when you're doing surgery and you're in the middle of it and you need to use it, you don't want to take time out if you can help it. And the settings are advantageous for us. You have preset settings for different procedures, which is really nice. I just usually use 3 for cutting and 3 for coag, and it works very well in almost everybody. A good generator is one that is reliable, works, and is easy to set up. Bipolar electricity is bipolar electricity. And so I think the main difference in a lot of the units is how well they're configured for use in the operating room and how quickly they can be configured to be set up. Basic thing is that you don't want to waste time. You're doing a diagnostic procedure, you see something you need to treat, you don't want to wait 20 minutes for somebody to figure out how to work the equipment. And so in my view, it's really easier for the nurses to configure and set up for me. It takes less time. That time is money and time is bleeding in operating rooms. The generator itself works great. As long as it's set up and configured right, no problem with resecting or using coagulation for achieving hemostasis. And so it resects very well, it coagulates very well. The main limitation really here is in an outpatient setting, fluid loss at hysteroscopy. So if you can work faster, you lose less fluid, you can do a better resection.
Richard Wolf, Spirit of Excellence.